Hi everyone, Ken Stewart, audiologist at HearCare. We're talking about what does it look like to get your hearing tested, and I think this portion of it is what everyone thinks about with a hearing test, maybe back in grade school when you pushed a button and heard certain sounds, and we certainly do some of that. But the most important thing is that we have a sound-treated enclosure. Obviously things need to be quiet to do a hearing test. We use really light, easy headphones, and so we want to kind of block your ears up to block out all sounds, and then certainly we would close this big steel door to make it very much sound treated and conducive for a hearing test. For those of us that are claustrophobic, we are able to test you outside of the booth, but typically we need to use some headphones that are a little bit more bulky. So as long as you don't mind sitting in some type of an enclosure, we can just use a really light little headphone that does the same thing. Most people hear some sounds better than others. You've heard of like tone deafness. With the way hearing loss works is most people can hear, we just lose our abilities to lose certain sounds. We call them almost like sound voids here. Most people think, gosh, if I could just pick up those little bits and pieces of what people say, I would hear great. And you know what? They're exactly right. Most people can, it's not a hearing issue for them, it's more of a clarity and understanding issue. So by letting us put you in a sound booth here, we test a summary of about 8,000 different tuning forks. Now that sounds cumbersome. We take a sampling, so it takes about 10 or 15 minutes in the sound booth. We really want to know where those sound voids come from. Then we can ascertain what's too loud for you. There's a phenomenon called recruitment, where people have an abnormal loudness growth. So people that have hearing loss, even though sometimes they need certain sounds to be a little louder, they can have a lower tolerance for those loud sounds, and we certainly don't want to make things too loud for those patients. Lastly, we want to be able to ascertain how you can hear a noise too. Most people don't have a hard time just hearing one-on-one. It's when they're in social environments, in restaurants and parties, and our testing procedures allow us to really identify what that means for you and what your potential is to hear in noisy situations. And then that helps us to ascertain what types of products that we should be fitting you with to be able to help you in those environments that best achieve your lifestyle.